Hello, my name is Dr. Sabrina Fabi, and I am a board-certified dermatologist practicing in San Diego. I'm a volunteer assistant clinical professor at the University of California, San Diego, and I'm also an associate research director at Cosmetic Laser Dermatology. We were privileged to be able to do a clinical trial using the ALASTIN skincare system. It was specifically a randomized, single-blinded trial of the ALASTIN topical healing regimen following a combination of IPL and/or pulse dye laser with a Q-switched alexandrite laser, followed by a fractionated CO2 laser resurfacing of the face. In the trial, which was a single-blinded randomized trial where we took 15 subjects between the ages of 45 to 70 years of age, specifically with Fitzpatrick skin types of 1 through 3, and we randomized them to receive 10 on the ALASTIN skincare regimen and 5 to the Vanaply skincare regimen after a laser resurfacing procedure, which in our practice typically includes an IPL or pulse dye laser for vasculature, immediately followed by a Q-switched alexandrite laser, and then followed by a fractionated CO2 laser treatment of the entire face. Patients were treated for 3 weeks prior to their fractionated CO2 treatment with either the ALASTIN regimen or the Vanaply regimen, and then they followed on that same regimen for 12 weeks after the laser procedure. Patients were evaluated on day 1, day 3 after the laser resurfacing, day 4 after the laser resurfacing, day 7, day 28, and then at day 84 after their laser resurfacing procedure. When we were evaluating to determine whether one system helped patients heal faster than the other, based on the investigator assessment at day 1, day 3, day 4, and day 7, was that from day 1, day 2, day 3, and day 4, the ALASTIN procedure enhances system showed a trend towards helping patients heal faster than the Vanaply system, specifically applying the ALASTIN nectar immediately followed by the balm and reapplying the balm as frequently as necessary to be able to maintain moisture to the skin. The Vanaply group just applied the Vanaply ointment every 2 hours or more if needed to, again, ensure constant moisture to their face. By day 7, there was a statistically significant difference in the group that was on the ALASTIN procedure enhances system versus those that were on the Vanaply system, as deemed by the investigator. Those that were on the ALASTIN procedure enhancement system also demonstrated to have significantly less erythema and exudation by day 3 compared to those that were just on the Vanaply ointment every day. To correlate what was seen clinically, the patients or subjects also reported significantly less skin tenderness, burning, and stinging that was also noted to become significant by day 3. The ALASTIN procedure enhancement system not only helped patients achieve less exudation and erythema at a quicker time point than the Vanaply system, but it also was noted that those on the ALASTIN enhancement system showed statistically significant higher long-term subject satisfaction after the fractionated CO2 treatment than those that were just on Vanaply at the day 84 time point. Patients reported that they felt their skin looked better and were more confident with the way they looked. They also stated that they would continue using this particular regimen, statistically significantly more with the ALASTIN regimen than with the Vanaply regimen. And they also stated that they would recommend it and more likely to recommend the ALASTIN enhancement system than the Vanaply system. At day 10, all those that were on Van-Apply ointment changed to the Van-Apply moisturizing cream. At day 10, all that were on the ALASTIN enhancement system changed from the skin soothing balm to the moisturizer, but the nectar continued. These are representative photographs of patients that were on the ALASTIN enhancement system compared to those on the Van-Apply ointment system. You can see in the top row, the patient looks significantly better at day 4, correlating with the significantly less exudation and erythema that we saw with patients on the ALASTIN enhancement system as early as day 3 compared to those on the Van-Apply system. By day 7, you can see how the patient on the ALASTIN enhancement system looks like she is almost back to baseline and can resume her daily activities versus those on the Van-Apply system. Again, another representative photograph of a patient looking even more crusty and bloody at day 1 after the CO2 treatment, but you can see how quickly she's recovered after being on the ALASTIN enhancement system at day 4 compared to the person on the Van-Apply system, which was our standard of care mainly because it has no fragrances or has any other additives or preservatives that patients have ever demonstrated an allergic reaction to. At day 7, the person on the ALASTIN enhancement system is now again returned back to baseline and can resume daily activity, where the patient on the Van-Apply system still demonstrates erythema and crust. Another representative photograph on the top row, a patient on the ALASTIN enhancement system, again, day 1, day 4, and then day 7. And you can see that at day 7, the patient on the ALASTIN enhancement system looks a lot better than the patient on the Van-Apply system, who still shows or demonstrates erythema underneath the eyes. So how do I do it in clinical practice? Well, after this clinical trial, it really changed not only my practice, but that of the entire practice that I'm in at Cosmetic Laser Dermatology, where we do a lot of aggressive laser resurfacing procedures, mainly because we're in Southern California, and we have a lot of patients with deep static rhytids that really need and can benefit from a CO2 resurfacing versus the non-ablative fractionated devices that we also have, but that just don't do as much as the fractionated CO2 resurfacing procedures. So after a fractionated CO2 treatment, or even after a fully ablative CO2 treatment, I have my patients immediately start the ALASTIN procedure enhancement system. I feel comfortable after the clinical trial that the nectar and the balm are well tolerated, and so I apply the nectar immediately on the table after I've completed the CO2, and then apply the balm on top of the nectar. And then I have them continue to liberally apply the balm, as I want to maintain constant moisturization of the face to optimize clinical results. I have them apply the nectar again at night. So they use the nectar twice a day, and they use the balm repetitively throughout the day, especially since I incorporate vinegar soaks, and I have them doing vinegar soaks every 2 hours for the first 4 to 5 days to help alleviate some of the crusting they experience from the fractionated CO2. But it's not just for fractionated CO2 that I use this procedure enhancement system. I have now started to incorporate the same system when I do microneedling RF, as again, I have to a degree caused abrasions in their skin, and so to try to help them heal and recover faster, I have them use the nectar immediately after the microneedle RF, and then I have them apply the balm, and I continue to do that, the nectar twice a day and the balm as frequently as possible to keep the skin moist, because I find them to get to baseline faster if I have them on the balm than if they just use a moisturizing cream. I also do the same for my non-ablative fractionated laser treatments, specifically with the Fraxel Restore, which is the non-ablative that we have in our practice. So this has changed my practice because I know that I can safely use it when I've created holes in the epidermis and I haven't developed any type of delayed granulomatous dermatitis or any type of allergic reaction. So I know it's safe to apply immediately after I've ablated the skin. Based on earlier clinical trials with the tripeptide and hexapeptide technology, we understand that as a function of age, our overall matrix has many broken down collagen and elastin fibers. And although we're stimulating new collagen with many of our different lasers and technologies, it's not an optimized bed or milieu to stimulate that collagen when you have a lot of elastin fibers that are fragmented in that matrix. And so based on a clinical trial that was done to show that when you applied specifically the nectar for 2 to 3 weeks prior to any collagen stimulating procedure, and it showed that that matrix had less fragmented fibers and was optimized to stimulate new collagen production from the collagen stimulating procedure, I now think it's mandatory, and that's the reason why in our clinical trial we had patients start the ALASTIN nectar for a minimum of 2 weeks, ideally 3 weeks prior to receiving their fractionated CO2 treatment. Since we have a pre-op before any ablative procedure in our practice, our nurse is able to incorporate this quite readily for ablative skin procedures. But for our non-ablative procedures, I try my best to have patients start this, again, at least 2 to 3 weeks, because it's based off the same premise that you're trying to stimulate new collagen and elastin fibers. But sometimes it proves to be a little bit more difficult to get a 2 to 3 week window. Nevertheless, I have them continue after the procedure, and it has shown significant improvement. But the most important reason as to why we did this clinical trial, in addition to the fact that science shows that with this particular tri- and hexapeptide technology, we're able to create a wound bed that is more optimized to stimulate new collagen production, and what we found was that patients had better results at 84 days after the procedure than those that were not on the system, does this make a difference in my patient's overall experience? Because ultimately, undergoing a CO2 laser treatment can be quite stressful for patients, and they wake up in the middle of the night commonly complaining of their face burning because many of the ointments that we were previously using would dry up in the middle of the night. And so it could prove quite uncomfortable for patients to undergo this procedure. So it was also intended to try to establish whether this enhancement system can improve the experience our patients go through when they undergo a CO2 procedure. And what we found was that many said that it felt soothing on their skin after they applied it, especially after the vinegar soaks, and that it didn't feel as goopy, or that a residual stayed on that couldn't be readily washed off with a gentle cleanser or with a vinegar soak, versus some of the less sophisticated ointments that are more dimethicone-based and leave this thick film regardless of how you try to wash it off. So it was very soothing, and it was more elegant for the patients that have previously used other ointments in our practice. In my clinical practice, the ALASTIN procedure enhancement system is always built into the quote that my patients receive prior to a fractionated CO2 resurfacing procedure. And then it is given by our nurse during the pre-op visit. But I will state that your patients are going to need a little bit more of the balm that comes than what comes, initially given to the patient in the bundle. So I always tell them, and then the nurse also reiterates that they may need to purchase more balm as they're more frequently applying that than the nectar after the procedure. Patients understand that, and they usually ask as they come, because we typically see our patients at post-op day 1 as well as at post-op day 5, and then again at post-op day 7 or 8. So by that time, they know if they're running out, and they just generally buy that separately. So we sell it as a bundle, but then we also have the individual items for them to buy separately if for one reason or another they want to just buy one of the products alone. So with that, I conclude. Thank you so much, and thank you for letting me share my experience on this clinical trial that we were able to do on the ALASTIN enhancement system.